Hi everybody, this is Shannon from the Nursing Education Department at Baylor St. Luke's. Today we're talking through applying 5-lead telemetry to your patient. So we'll begin by discussing the initial steps, what you need to gather as far as supplies, and how you'll prep your patient. Then we'll discuss the position and application of all of the leads, and finally how to hook up to your telemetry box and to know that it's working and transmitting your EKG signal. So first of all, you'll need these 5-lead electrodes for the patient. Remember that these are only good for 24 to 48 hours. So when you open up the package to place them on the patient, we want to make sure that we write the date on every single one of them, just so that we know exactly which day they were applied, so we know when they need to be changed. If we leave them on for longer than 48 hours, there is gel on the back of them, and that gel starts to dry out, and it causes our signal not to be transmitted as clearly and can lead to a lot of false alarms and artifact that will be picked up so that we're not accurately reading the patient's heart rate and rhythm anymore. You'll also need a basin that will fill with soap and water. You'll need some cloths to be able to clean the patient's skin with the soap and water, and you'll also need one dry cloth, because what we'll do is rough up the patient's skin just a little bit to allow for better adherence and transmission of the signal with the electrodes. We'll just use basic soap and water for the skin preparation and the cleaning with the soap and water. Of course, you'll enter the room. We're going to perform our hand hygiene on entrance. We'll make sure that we've introduced ourselves to our patient and let them know what procedure we'll be performing, that we're going to be putting the telemetry leads on, and that they must remain on the patient at all times. We of course need to expose the patient to be able to apply the leads, so we'll want to make sure that we ensure privacy is happening for the patient. If there's any visitors in the room, we'll ask them to leave and let them know that they can be invited back in once the patient is covered up at the end of the procedure. We'll apply hand hygiene one more time prior to beginning, and we'll make sure that we don clean gloves. So the next step will be to prep the patient's skin.